Senator Lee, thank you for joining me.
Thank you for having me.
On Tuesday, the Senate passed a bill regarding vulnerable adults and the maltreatment statutes around them. Can you walk me through what the changes will lead to?
Yeah, this is really, I think, significant legislation for Idaho. These are statutes that haven't been updated since 1998. And so when I first came into the Senate about 9 years ago and was initially a member of the Health and Welfare Committee, a committee that I've served on since that time, I really saw a disconnect between what the Department of Health and Welfare was doing and the Commission on Aging. And so what happened is when we had a vulnerable adult, and these are adults often who have Alzheimer's or other dementia-related diseases, we really didn't have the ability to provide, I think, the enforcement or the support services that our policy required. So folks got together and they really worked hard over this last year. I really want to recognize Director Judy Taylor with the Commission on Aging. But essentially what this does is, for the first time ever in statute, we can provide support services for caregivers before we get to a place where somebody has had maltreatment. And maltreatment is defined in this new piece of legislation really importantly as physical abuse, financial abuse, undue duress, human trafficking, as horrifying as that is. We had to add that in because there are cases where somebody is having, being forced to work or take care of grandchildren, and they just simply are not in the mental capacity to do that. So I'm really excited about some of the improvements, the definitions, but most importantly, it really delineates what the Commission on Aging with Adult Protective Services is supposed to do and what the Department of Health and Welfare does. And the department does licensing for facilities, and APS, Adult Protection Services, really helps to get into those issues and problems in our community, and it's a way to scaffold things so that people can stay at home. And I think it's a monumental piece of legislation that probably didn't get a lot of attention, and so I appreciate the opportunity to talk about it.
Some of the reporting requirements have changed, correct? What else can they do now that perhaps they wouldn't have been able to do under prior statute?
So again, I think that in addition to the reporting, when we saw a problem, so for example, if you had a neighbor who all of a sudden was outside in cold weather and not dressed appropriately, and you really could tell that this elderly person was struggling. Adults are not vulnerable just by nature, whereas children by definition are. But we know that we have vulnerable adults in our community, and so instead of calling the police, we can, or even if the police do happen upon somebody or we have a community need, now we can get Adult Protective Services to go into the home. And one of the examples that I shared is an elderly man who had untreated diabetes, and you can imagine what that does to somebody if you aren't getting your medication. It changes your mental status, and when people came to the home, they could see that the home really had some serious health and safety concerns. This individual was able to get to a hospital, get dialysis, and then come home with a little bit of support services with home care. And he is now healthy in his home, able to take care of himself, and he just needed that little bit of gap in service. And without Adult Protective Services in this statute being able to get some prevention pieces in, this is an individual who likely would have gone to a long-term care facility and been removed from his community, his home, and certainly didn't need to do that. So I think this really is a way to help people and save money, which I think is a great conservative value.
Speaking of saving money, you sit on the Health and Welfare Committee. This week there was a presentation regarding Medicaid and the efforts to address some enrollees who may no longer be eligible. Can you walk me through some of your concerns around that? You voiced quite a few to the Administrator of Welfare.
Yeah, I did. Thank you for the opportunity to clarify maybe some of those comments. We know that during the pandemic, the federal government was pretty restrictive on not allowing us to do income verification and disenroll anyone who potentially is no longer eligible. And now that that's over, we have the ability to really look at who is eligible and who should be receiving these benefits. And but the federal government has also put some pretty significant restrictions. They're going to make us slow roll this disenrollment. And so we have about 150,000 people who may be not technically eligible for Medicaid. And so my position really is, in order to preserve the fidelity of what Medicaid is in our state, we have to ensure that only those who are eligible are receiving those services. And I really want the department to be able to look at moving people off, and moving people off means moving them to Your Health Idaho or other plans that that may be more appropriate. We know that we struggle with funding Medicaid, and so in order to ensure that it really is for the most at need, we've got to make sure that we keep those parameters in place.
And of course, the reason that the state was unable temporarily to remove people from Medicaid was because of the COVID emergency. Congress has since changed to that. I believe CMS is asking for 1/9 of renewals a month, and we have about 150,000 enrollees. Is your concern that we need to move the process faster?
Yeah, I do. I think we need to move it faster, and of course, I also appreciate that the federal government is not incentivizing that, and so they are putting restrictions. In fact, if we go faster, then they have told us that they would fine us and do some other things. And we looked at, how do we create capacity? We have a lot of employees who have a regular job, and now they're having to do these other pieces. And so one of the things that I've offered, the federal government is even so restrictive that we can't have contractors. They won't allow us to hire additional people to do this exact process.
Right.
But nothing says that we can't hire additional individuals to do the regular eligibility and free up our current employees to take a look at this. And again, I think it really is about fidelity for the program and ensuring that our policy of taking the steps needed to move people off who are not eligible will reduce costs, and it will also preserve the function of what Medicaid was intended in Idaho.
Do you believe Health and Welfare has been receptive to the legislature's concerns?
I think they're trying within the parameters of how they're reading the guidance, and so it is certainly our role to push a little bit and to come up with some other creative solutions. And I think they're trying. We may have a little bit of a disagreement on how fast this should go.
Okay. Speaking of disagreements, the House had several notable bills that will soon come before the Senate. Let's start with. There's a House bill that passed that prohibits gender-affirming care to transgender children that has not yet come to the Senate. What do you anticipate?
So that bill has been referred to Judiciary and Rules. Last year it was referred to State Affairs. And so I think that's a little bit of a difference, and I think that this bill gets a hearing. Last year the Senate didn't respond favorably, at least to having a hearing, but we have a lot of new members, and we have a lot of, I think, new interest for the issue. So I think this bill gets a hearing.
What are your interests?
So my interests are really in preserving the rights of parents to make fundamental decisions for their children. I am absolutely opposed to gender reassignment surgery for children under 18, and I think those surgical pieces we all can agree on. But I've met with many families, and these are heartbreaking, scary times for these families, and I think it's one that we would do well to really make sure that we are crafting the right policy. We have stood strong with allowing our parents to make decisions for their children. I think this gets caught up in a lot of other issues, but I can remember tearfully supporting parents' rights to make medical decisions based on their religious beliefs, their fundamental beliefs, and so I think that we would do well to pause and make sure that we are doing the right thing, and not just creating a headline for behaviors that maybe people are assigning other, I think, motives to. And again, when I talk to families who have struggled with these issues, and these are families who are in Idaho, who, when their child comes to them and says, "I'm struggling," they are scared. And I wonder how many of these families want necessarily the government to come into their living room and make these decisions. I've talked to doctors and many people. Now, again, I think we all agree that surgery for dysphoria in any way for children under 18. Again, one of the examples I've given is if we had a 14 or 15-year-old who had an eating disorder, that child would not get to have a gastric bypass, right? And so we really want to make sure that we are, talking about these issues, but ensuring that our parents are able to work with medical providers and psychologists and really grappling with these hard issues.
Sure. And the bill, just for folks that may not know, the bill is about more than just surgery. It would also prohibit the use of cross-sex hormones, puberty blockers, and in committee in the House, there was some medical associations that oppose that, local Idaho physicians that explain that they're not seeing a lot of surgery, or if any surgery, in juveniles, but they do use some of these hormone blockers. For various medical reasons.
And that's really the challenge of being a legislator. I'm not a physician, but sometimes I play one in the legislature and I have to make these decisions. And so I really think that you're going to see in the Senate a really thoughtful hearing. If it gets to a hearing, Senator Lakey is a phenomenal chairman who I think is going to make sure that all sides are represented. And so I would just encourage people to participate in the process and we really are setting policy, and so I'm hopeful that we'll have some robust discussions. I've heard from people on both sides, and these are deeply held beliefs, and so these aren't really issues where you can nuance. These are tough issues, much like when we discuss guns, when we discuss abortion. I mean, these are deeply held issues.
I want to touch on one more topic with the last of we have about a few minutes left. There was a House bill that did pass that would change the oversight of the Office of Performance Evaluations. The oversight is currently held by JLOC, which is a bipartisan committee. It would change to the Legislative Council, which is also bipartisan, but it is majority-led. What are your thoughts on this bill that will soon come before the Senate? Well, if it gets a hearing, I can't predict that.
Yeah, I can't predict that either, but I'm a big fan of the Office of Performance Evaluation, and I've made a number of requests for some pretty significant reports that have helped change policy, specifically with foster care and child welfare. We use those as data, as information to really change and transform that system. So I'm grateful for those reports, and I've been the beneficiary of that. So my preference is let's keep it as it is. My ultimate goal, though, is I want to preserve the Office of Performance Evaluation. And so I can also appreciate, right now I think it works to have that balance on JLOC. The Legislative Oversight Committee is also a fantastic committee, and the minority is also represented on that committee. Certainly not an equal, but probably more of a majority than if you take the entire legislature together.
Sure. So I think proponents of the bill would argue that we are a Republican majority state. So should the oversight of OPE be oversight from a committee that is Republican led? What's your take on that?
So I can see that.
Sure.
The majority likes to be the majority. I think I've already been on the record a few years ago of saying we really need to get the politics as much out, the partisanship as much out of these review things, so that these are not punitive reports, that they really are informational reports. And so I think I'm already on the record as wanting JLOC to stay the way that it is, but ultimately, if it's the will of the Senate, I will be a champion of just making sure that OPE exists as its own independent group rather than being housed under some other areas as has been proposed.
Outside of individuals who are maybe working in the press corps, lobbyists, and legislators, I think they don't know what OPE is. They don't always read the reports. You offered a great example, some of the work they did on the foster care. We have a couple minutes left. Can you give me some examples of what you learned from the foster care report?
Yeah, we learned a lot. We learned that we had a statute that requires our children to have representation in these cases. So a child who's in a child protection case, the parents have an attorney, and our system requires that these children have guardian ad litems, which is just a phenomenal program. We should talk about that sometime. but these are really the advocate and the voice for the child, and we were able to kind of look through this systems review and see where we had gaps, where children were actually not being represented. And so it was not only not following the statute, but it was an opportunity to look and say, how do we fix this? And you know, in years later, our courts have actually picked this up, and now they have a guardian ad litem committee, and I actually am privileged to serve on that. And we're starting to look at a whole systems look at guardian ad litems. The other piece that we really found is that this was such a closed system that there wasn't transparency, and so just bringing a little bit of sunshine to these most vulnerable children's cases, I think has systemically and systematically improved the culture of the department, and also impacts for these children and these foster families.
All right, well, Idaho Reports will keep an eye on whether it gets a hearing in the Senate, but I do appreciate your time, Senator Lee.
Thank you.